What's up, my people? Welcome back to my channel, and today is World Diabetes Day, and we're going to talk about diabetes, especially gestational diabetes. And I have a special guest. He's called Lawrence. He can introduce himself.
My name is Lawrence Njane. I'm a friend of Dr. Linda. We are happy to talk about diabetes today on this World Diabetes Day.
Yes, ni daktari pia, acha kusema friend. Anyway, yeah, so if we look at the WHO figures, you find out that for every pregnant woman, 2 to 10% of them are likely to develop gestational diabetes. So what is this gestational diabetes that you're talking about, Dr.
Yeah. So as everybody knows, diabetes is increase in blood sugar levels above normal. So, and therefore, when gestational diabetes is when you have that kind of phenomenon in a pregnant woman. Mm-hmm. Yeah. Mm-hmm. So during pregnancy, so there is a high risk that some of the mothers are going to be having high blood sugars. Mm-hmm. Okay. Mm-hmm. That's what we call gestational diabetes. Yeah. So you see, a mom has no diabetes before, but when they are pregnant, they are going to be showing the high blood sugars during pregnancy. So you can say that one is gestational diabetes, which is quite temporal. Yeah? Yes.
Yeah, so in simple terms, gestational diabetes is ugonjwa ya sukari ukikuwa na pregnancy. So just high blood sugar when you're pregnant. Yeah, and we can look at now what really causes this gestational diabetes, because you realize that most people, like, gestational diabetes only comes about when someone is pregnant. For example, I don't have diabetes right now, but if I fall pregnant, I might have like a risk of getting gestational diabetes. So what really causes this?
You see, when a woman is pregnant or they're expectant, so they have a baby growing inside of them. Yeah. So we expect a lot of changes, and we see them, the hormonal changes and many changes. So one of it is blood sugar level will change. So when a woman is pregnant, so the placenta, okay, which is the part that touches the baby and the mother, okay, so it produces some hormones that reduces the sensitivity of the maternal tissues or the tissues of the mother to insulin. So, and you know that insulin is one that which lowers the free circulating glucose in the blood vessels. So when the placenta is producing those maternal hormones, those placental hormones, including growth hormone and very many other hormones, so it causes what is called general insulin resistance in pregnancy. And therefore, that's going to cause that a mom, when is pregnant around 24, from 24 weeks up there, you're going to experience constant high blood sugar levels. That's causing the gestational diabetes. Yeah. So
you've seen now what really causes that. It's all about now the hormones that the placenta produces actually. And we look at now the risk factors, because there are very many pregnant women. Some usually have like gestational diabetes and some don't develop gestational diabetes at all. So what really predisposes someone to getting gestational diabetes?
Okay, so we can say if you have diabetes before getting pregnant, of course when you become pregnant, you're going to experience gestational diabetes. Then another risk is what you call, if you're not the first pregnant, the second subsequent pregnancies, and in the other pregnancies you had experienced gestational diabetes, so you can be sure you're going to get gestational diabetes. So the other risk factor is you see the age. So women who conceive beyond 35 years of age, they are highly likely to get
gestational diabetes. So the reason why I'm laughing, what tunaambiwa like as ladies, your clock is ticking. But anyway, I don't know, but don't give birth beyond the age of 35.
Yeah, there is a high risk.
There's a high risk.
The other thing is obesity. So those women who have high BMIs and they become pregnant, there is a high risk they're going to get gestational diabetes. The other things we have the hormonal changes and hormonal replacement during pregnancy, especially when you are doing progesterone hormone treatment. There is a high risk that you can get gestational diabetes. The other thing is polycystic ovarian syndrome, which we have talked.
Actually I did a video on polycystic ovarian syndrome and infertility.
Yes.
And you can see when you're doing, like when someone has polycystic ovarian syndrome, their blood sugar is usually high. So I'll link the video up here so that you can go and check it out.
Yes, and maybe last but not least, you can say the family history of diabetes mellitus. And family history, I mean, you see in a family, if your uncles, your aunties, there are people who have diabetes mellitus. So there is also a chance or a risk that when you're pregnant, you can also get gestational diabetes.
Okay, so now you've seen the risk factors, and also to add on what you said about genetics. If you have also a family member who has had gestational diabetes, like maybe your auntie had gestational diabetes, or your sister or your mother, you are at a high risk of getting gestational diabetes. So now we've seen what actually predisposes someone to gestational diabetes, and so Doc, how can we actually prevent someone from actually getting this gestational diabetes?
Prevention is better than cure,
yeah, sure.
So one of the most key thing we can tell to people and the people who watch our channel is that when somebody is pregnant, it's very important for them to attend what is called antenatal clinics. Because it is only then when the clinicians, the doctor and the nurses can be able to see whether you are at risk. Okay, that is very important. The other thing is somebody needs to take proper care of their diet. Okay, so ensure you do proper dieting, do proper exercises. These are the factors which you can say from a patient perspective, you can able to modify and reduce the risk.
That's why I always just like tell you guys, exercise is really important. Whether you're pregnant, whether you're not pregnant, your diet and your exercise really plays an important role.
Can we also add that you need to get pregnant before 35?
So wasichana, pateni mabwana or your boyfriend, make sure you get pregnant before the age of 35, because when you're above that age, your risk will increase. Let us look at now the complications of gestational diabetes, like the effects of gestational diabetes on both the fetus and the mother, so that you can actually see how gravid and the big magnitude of actually this gestational diabetes. So how does it affect the baby? How does it affect the mother?
Okay, so once you have confirmed that you're pregnant and you have gestational diabetes now, and we are monitoring you, so there are various challenges which might occur. So to the mother, one of the biggest challenges is that there is a 50% chance that you can actually develop diabetes mellitus or diabetes type 2, after giving birth. That means you're going to be on treatment for a long time.
For your life.
Yes. So another risk to the mother is there is the high likelihood that you might go cesarean section, what they call CS. You're not able to do normal delivery, and you're going to see why. So those are like the two challenges, big challenges to the mom. Do you have another reason?
So another reason, yes, when someone usually has now gestational diabetes, there's a high likelihood that you can develop hypertension, which is high blood pressure. And you know the effects of high blood pressure, it can complicate and kill most of your organs. So it's important to take care of yourself, because you realize people who have actually diabetes, they usually end up developing kidney failure, eye problems, and every other complication. So hypertension also someone can develop, preeclampsia and the eclampsia that we talked about, just because you have gestational diabetes.
Okay, when you look at now to the unborn child, so when the mom is having high blood sugar levels, so you expect that even the unborn child has high blood sugar levels. So, and we know from those people who understand little about medicine, so when you have high blood sugar, you have more insulin, right? So when you have more insulin, so the blood sugar is going to the cells to stimulate growth there. So you expect that if the mom has high blood sugar in her circulation, so does the fetus. So there is high likelihood that the fetus is going to be absorbing more glucose. The baby can become so big. So that is one risk to the child. So, and that means the child can become obese during birth. Okay. So the other thing, see, when there is a high blood sugar levels in fetal circulation, we call it the blood become like hyper or smaller, and the baby will tend to pee a lot. So it means that the amniotic fluid, that the fluid that cushions the baby, will increase. So you have what we call hydroamnios. Hydroamnios fluid is polyhydramnios, is where you have amniotic fluid excess, and this can cause something like preterm birth. Okay. So that is one. And the other thing you can also have when the baby now is born, you can get birth injury to the mother and to the child. So, and also we can also get when the baby is born now, we can have what respiratory distress syndrome.
Yes.
The baby could also what else could the baby experience when also because the baby has been used to high glucose levels before birth, and during birth, there's disconnect between the placenta and the mother.
And the mother.
So the baby might actually experience severe hypoglycemia,
yes.
and they might need to be admitted to ICU.
Yeah, in short, hypoglycemia is low blood sugar.
Yes. Yeah. The blood sugar for the child can come extremely low after birth.
Yeah.
So where they might need to be admitted in ICU. So those are some of the complications
now,
which
when
you
the
can
baby
get.
is actually born, there's also high chance that the baby might develop type 2 diabetes later in their life, or they can be obese later in their life. So you can see the way high blood sugar can really affect both the mother and the baby. And that's why we insist, go for your antenatal clinics, go to your doctor, don't skip any antenatal visit. Tafadhali, don't skip that, because even at the end, this type 2 diabetes or gestational diabetes can even complicate, and it can kill both the mother and the baby.
Yes.
And also for the baby, the neonatal respiratory distress syndrome that he mentioned, this is where by now your lungs will not develop well. And then the baby might end up now in an ICU setting when they're born.
Yes.
So I know you've seen the magnitude of this, and now we can look at the treatment.
Yeah.
So how is this gestational diabetes treated?
When the mother was having gestational diabetes and then they deliver in a healthcare setting, so there is a very good chance of managing both child and both the mother.
Yeah.
Of course, now we need to control diabetes, the blood sugar levels, like in other diabetes patients.
Yeah.
So to the mother, so first of all, they can do dieting.
Yeah.
Sometimes they can take what we call oral hypoglycemic, those medicine that you swallow to lower the blood sugar levels, something like metformin, or what is commonly known as glucophage and such. Either sometimes can go for insulin. And now when the baby is born, depending on the complications of the child, now the child is managed differently. Okay, so there's those children which are going to need oxygen if they are having respiratory distress. Okay, those children which are going to they are going to be put on dextrose if they are born with hypoglycemia. Yeah, so you can say the management or treatment now, especially to the child, is going to depend on the complications and how the blood sugar levels are controlled during gestation.
Okay. Yeah, so in the healthcare setting, you'll be really managed well. And that's why sometimes we advise, okay, not even sometimes, all the time we advise, if you want to give birth, please avoid those home deliveries and avoid going to those, what are they called again? Wakunga. Avoid doing home deliveries because complications might occur and you might have another disease and you don't. So we can look at some of the signs and symptoms that actually someone can present with, so that you can know that, like, heading towards gestational diabetes. And this happens between the week 20 to 24. So around there, if you notice the following symptoms that doctor is going to share, please run to your doctor.
So the signs and symptoms of gestational diabetes, they shall present like the other diabetes.
Normal diabetes, yes.
One is what we call the increased hunger.
Increased hunger, yes.
Like this habit you want to always
you're just feeling a lot of hunger and you want to eat.
That is one of the signs. The other one is a lot of thirst. So there is increased intake of a lot of food because you are very thirsty. There is increased urination. Okay. Sometimes because when you're pregnant now, because of the changes in blood sugar levels, you get a lot of infections, especially recurrent urinary tract infections. So those could be one of the triggers that can tell you this could be gestational diabetes.
Yes. Also to add on that, for the infection bit, many ladies during pregnancy, because of the hormonal changes and everything that is just going on, you're predisposed to getting infections. So if you notice that you have recurrent yeast infections and urinary tract infections, please rush to your doctor because you might be having gestational diabetes. This is because of the glucose that is present in your system, and then when it's passing through the urine, as you have said, it can, now the glucose, it helps in growth of now microorganisms like bacteria, fungi. So that is why people usually have a lot of like UTIs and these other infections when they're pregnant. So if you notice those, please make sure you run to the clinic and explain to your doctor how you feel. So I hope you've learned something in this video about gestational diabetes, and if you're pregnant, please make sure you once again, go for your ANC clinics and make sure you talk to your gynecologist about how you feel and every other time. So that's it for this video, and thank you so much. I'll see you on my next video. And if you have any questions, please leave them in the comment section, and please give this video a thumbs up and share with others so that they can also share. Thank you so much, and bye.
Thank you. Bye bye.